a corporate integrity agreement, or CIA, is essentially, it's a contract between the Office of Inspector General, or OIG, and healthcare providers or entities. So think of it as a way to get back in the good graces of the Medicare program, that typically lasts 5 years. I've actually seen some that has lasted longer, and I've seen some that are actually shorter, but I guess the average is around 5 years. And so instead of being excluded from Medicare and Medicaid, providers agree to specific compliance requirements. So they are admitting to the charges or whatever they're being accused of. And with that, they are taking responsibility and putting together all of the things. And so they sign off on this corporate integrity agreement. Now, the interesting part is these agreements, even while they're called corporate, they aren't just for big hospital systems. There are also independent providers that receive, and they don't call them CIA for them, they just call them integrity agreements for them. And there are some differences between the two that I noticed. But all of this creates some opportunities for us in the health information and revenue cycle space. And compliance, actually. This creates a lot of opportunities for us that I hadn't really thought about before. But I thought, so there was a hospital here, but there was a hospital in Cincinnati that got hit with a corporate integrity agreement, and everybody went ballistic. And this is one of like our top tier hospitals. Everybody loves this hospital. Everybody goes to this hospital if they get an opportunity, And so when they got a CIA, everybody was like, oh my God. And so lightweight, it was looked at as a bad thing. Like, well, you got a corporate integrity agreement, and, we don't really want to touch you, and we don't want to be bothered. And, it got a bad name. But the people who work there and the people in compliance there were shouting from the rooftops, because again, now the organization has to pay attention to their compliance department, officer, program, etc.